we were talking about guys that are hurt, like JPP. That's something else we discussed with Rick Stroud, and is Bruce Arians being overly optimistic about his return in October with the neck injury. And Rick said his evaluation is coming up any day now. So we figured who better than to figure out, could stem cell therapy help a guy like JPP, like Tyler Glasnow for the Rays, like Kendall Beckwith for the Buccaneers, Dr. Locks. We have some, I was just on TV with Dr. Locks and Derek Brooks, who was in the studio yesterday but ran out of here before we got on the air with him. And Dr. Locks, first of all, welcome. How are you, buddy?
I'm doing great, Ron. Thank you.
You're looking solid, as always, taking care of yourself.
That's right.
You really helped Derek Brooks. You started with his wrists, then you ended up doing, was it both knees?
That's correct.
And he's good to go.
He's perfect, just like you.
Yeah, I don't know about that. But before we get to guys like Glasnow and JPP, I wanted to mention something. When you did my shoulder and I had extensive damage, was that an X-ray you took, or was that an MRI when you took pictures of my shoulder and arm?
We did an X-ray. We sort of ran out of time due to, I think there was a little engagement on your end.
Yeah, that's right. Yeah. Wow, you got a good memory. Yeah.
Thank you, sir.
I had to get married quick. Not pregnancy or anything. No, but anyway, you did an X-ray and you saw the damage.
Yes, sir.
And what did you see?
Well, there's damage that you can see radiographically on X-rays from changes over time, and then the other part, especially in a lifter like yourself and a pitcher, is there's the physical exam, the findings that you see, classic changes, if for impingement syndrome, and in your case, the bicep problem. And it's very evident when you examine people.
Well, I've been bothered with this shoulder for a long, long time, and I finally blew out, I think, throwing batting practice for a high school team years ago for Admiral Farragut. But the thing is that I didn't want to have shoulder surgery. I talked to Ian, who had shoulder surgery, told me it sucked, and the rehab time was awful. Then I talked to other people who say it didn't even work. They get shoulder surgery, and it didn't work. So I figured maybe I have a tear in my labrum, I have a tear in my rotator, and I had a torn bicep. And I thought, that's not fixable with stem cell. I go to you. You did it on December 14th. The pain slowly, I would say slowly because it took a few days and then weeks, and then here we are 7 months later, 8 months later. The pain is gone. It clicks still. There's still damage in there, but the pain is gone. And it didn't hurt, because people ask, what is it like? What do you do? And explain how you take the good cells out of fat deposits.
Well, we can use multiple reservoirs, the bone marrow or the fat. And the main thing is if you take very good care of the patient and you know what you're doing, it isn't very difficult. But every patient's different, and some people are nervous Nellies, and some people are very good patients, and it's not a big deal.
Well, it didn't hurt me at all. Yeah. Now, could you help a guy like JPP with a neck?
Possibly. Necks are very difficult. There's a lot going on. There's a lot of moving parts. I like to say spines are like a Swiss watch, a lot of parts. But as you age or there's more damage, it's like a rusty Swiss watch. So it's a lot more complex.
All right, and then Tyler Glasnow. The injury wasn't supposed to be that bad. It was a strained forearm, and then he had an MRI, and there was no damage to the UCL. From all the Tommy Johns you have done, or all the pitchers that have either had Tommy John or wanted to avoid Tommy John surgery, it starts with a strained forearm, and then there's that UCL problem. Is that how it works with Tommy John, the injury?
Yes, the extensor mechanism exerts in the ulnar collateral ligament. It's all part of the elbow mechanics. And just like the shoulder pitchers with labral tears and UCLs, a lot of them don't get better with surgery. So it's a very risky thing. Now, there are people like Tommy John who go on to have excellent careers, but that's not the norm. So a lot of people are starting to look at it, especially the ones who are paid a lot of money, are looking at it like, well, if I don't do better with surgery, maybe I should be conservative. Therefore, a lot of them are moving towards stem cells as a treatment measure, because you can always do surgery if it fails.
So instead of Tommy John surgery, having stem cell therapy. Well, Jay and I were talking about Masahiro Tanaka. It might have been 5 years ago when he had a tear in his UCL, and we were thinking, well, that's going to go any day now. And he's still pitching very effectively.
Well, you don't know what he had. And I've had a couple pictures that they don't want you to talk about it, and one of them lost a $100 million contract. The following season, he got re-signed once he was throwing 95 again. And on the roster for the new team, it said after undergoing an undisclosed procedure over the summer, he's now 100%.
Oh.
They didn't say he went to Dr. Locke's.
Really?
That's correct.
Wow.
So some people don't want to talk about it.
Why?
So they just don't. But a lot of people are moving towards it. Like Rafael Nadal has admitted, I know his doctor. But there's not the stigma there used to be. But there's still a shroud of the team doctor dynamics that Major League Baseball has control over it. But there are people, and especially if you're dealing with surgeons who've operated on you before, they don't want to talk about that. So that could be that some of these players have already had it and just don't talk about it.
So they could have had stem cell therapy, and that's the reason they're still
Correct.
still pitching.
Correct.
Without Tommy John surgery. Somebody has a question here for you. Let's get to Chris real quick. Go ahead, Chris.
Hey, Ronnie. I'm the soccer player that talked to you a few months back about the shoulder thing. I think I've got the exact same problems you do, except I have a intrapinatus tendon tear or something that they say is in the back of my shoulder, like on your shoulder blade area. But all the agonizing pain I'm having is like in my bicep. And
hey, dude, you're preaching to the choir, because I know it's my shoulder problem, but I had pain right where the bicep and the shoulder kind of meet, and the bicep aches. Yeah, man, I'm telling you.
Oh yeah.
Stem cell. I mean, try it. Try it with Dr. Locke's. It worked for me.
I'm just waiting to save up the money, and I'm going to have him do it.
All right. A lot of people ask how much it costs.
That depends on what we're doing and the complexity, if we're doing multiple joints.
Can you give us an approximation?
Anywhere between 5,000 and 9,000.
Between 5,000 and 9,000.
And the thing that you this caller said, and you were mentioning about your shoulder and the bicep, the long head of the bicep inserts onto the glenoid labrum. So if you're tugging and tugging, that pulls on the labrum, so it kind of goes together.
And when you're tugging and tugging, that's like when you're lifting.
Correct.
Yeah.
Correct.
All right, what about an ankle? We talked about Kendall Beckwith, the linebacker for the Buccaneers. Have you worked on ankles?
Many times.
Yeah?
A lot of runners, tennis players, soccer players. We've had some with tragic injuries that ended up with dead ankle bones, and we've helped them get back. So same condition Bo Jackson had. We've been able to help the teenagers, and they get back to their sport.
The number is 833-4-STEM-CELL, 833, the number 4-STEM-CELL, if you're thinking about getting fixed up and you want to avoid surgery. It worked for Ian. It worked for Derek Brooks. It's worked for a lot of guys that you're not allowed to talk about. Do you sign non-disclosure NDAs, non-disclosure agreements?
No, we have a doctor-patient relationship and HIPAA, and unless the patient agrees to allow you to speak about it, you can't.
All right. Well, three guys that are allowing you to speak, and me, Ian, Derek Brooks. I'm sure there's other guys that you've worked on. Did you ever end up working on the bodybuilder Frank Zane?
No, Frank had some other issues, and we had to postpone it. But I did. I've known him for years. I did take care of Ronnie Coleman.
Ronnie Coleman. Mm-hmm. Now, what did you do for him? I saw. Was he walking on crutches?
Oh, the problem with Mr. Olympia is in order to get to that level, the abuse your body takes over the years. So as they get older, they have so much problems with arthritis, and it was his back and his hip.
Were you able to help Ronnie Coleman?
Yes and no. Ronnie was a freak of nature in that he was exceptionally strong, and he didn't want to give that up. So there are videos of him doing dumbbell presses with 200 pounds in each arm, and the wear that does on your shoulders.
Oh, that's great for the shoulders.
And a 2,600 pound leg press. I mean, I saw his back, the inside of his MRI. You shouldn't do that stuff.
Yeah, the human body's not made for that.
No. But he could do it, but it's not a good idea.
All right, we're going to put that up. We also have a picture with that was a good day on Channel 8 with you, Derek, and myself. Dr. Locke's always great to catch up to you, and knees are next, and then who knows, the whole body stem cell treatment.
We're working on that. Thank you, Ron.
You got it, man.